My name is Gwen Anderson, and I'm a behavioral health graduate from the MPH program at USF, and I'm also the current Health Program Student Association president. So, Dr. Langle, if you want to introduce yourself.
Thank you. Hi, I'm Kelly Langle, and I direct our Master's in Public Health Behavioral Health concentration.
But what about this year's class do you particularly appreciate and enjoy?
Every cohort, every entering class, as they go through the program, they have a certain personality. And it's really remarkable, but it's something that we really witness every year. And so this graduating year's MPH Behavioral Health cohort has been a joy to teach. They are super engaged, and from the very first class that they took with me, their first semester of the program, they talked, they participated, they asked questions, we had great discussions. And so they've been a joy to teach because I don't have to spend a lot of time trying to encourage them to speak up. They already came into the program talking and wanting to engage with each other and engage with the course material, engage with the applied world that public health is.
So I know particularly people are interested in kind of how technology is being used, particularly in public health and the next population of public health professionals that were graduating. So what were ways that technology was used by these students?
So the behavioral health concentration, we prepare our students to take the Certified Health Education Specialist exam. It's called the CHES exam. And we actually designed the MPH Behavioral Health curriculum so that they would be eligible to sit for this exam. One of the requirements of the CHES exam is that they have a pretty good exposure to using different technology tools for health education purposes. The basic one that they learn their first semester is Canva. Canva is a terrific tool. It's been around for a while now. It's very user-friendly, and it also has evolved in the tech landscape. And so it used to be that you would create just very simple flyers or infographics now. And now you can make incredible social media, very interactive graphics that are constantly moving around and showing new aspects of the visuals or messages. So they also have to create a communication campaign, and so they might create TikTok videos, which actually at this point is a very steep learning curve. They always jump in and then they say, wow, that was really, really hard. Sometimes they will develop websites actually. So as part of a campaign element, they might go ahead and mock up a website. So they're having to learn basic HTML, for example, or they might use WYSIWYG programs to help develop that. They might develop a digital health campaign where they're going to find some SMS or multimedia platform, and they're going to go ahead and use that to mock up those very well-designed health communication messages that are part of their campaign. So they're really using technology tools to disseminate public health information, actually. And so I say this is just a little preview of what you actually will be able to do in your public health jobs. So I think for technology in that way, education purposes, that's something that I can definitely speak to. And then they're learning technology in a lot of their other classes too. So not just for public-facing kind of communication or dissemination aspects, but also in terms of how can we better use our new tech tools for data analysis, for example, right? And so that's something that around surveillance, around AI, around statistical analysis, there's all these new tools that are coming up, and we really, as faculty, try and integrate learning of those tools into our classes. Health concentration, we have a really close collaboration with the USF Office of Health Promotion Services. And so the HPS office on campus provides health education and health counseling to the entire USF campus community. It's students, it's staff, it's faculty, and oftentimes beyond into the larger San Francisco and Bay Area. And so one of the things that they love is that our students are trained in how to design and disseminate social media for their own messaging and their own programs. And so that's another way that our behavioral health students in particular are really honing those tech skills and honing those skills in social media and honing those skills in using whatever new technologies are coming out that are public facing for public communication.
Nice. So what kind of growth have you seen in the students? Obviously you mentioned the skills they built on the things, but what other kind of like personal growth and other things have you seen?
Something that I learned this from a graduate from a couple of years ago, and at the end of the program, at the end of the MPH program, she said to me, Dr. Langle, this has been an amazing experience. It's been an amazing 2 years of my MPH, but the thing that actually I've gained the most? And I said, Becky, what? And she said, my voice. I have learned what my voice is and how to use my voice. And so this is something that really keyed me into how are we as faculty at USF, at a Jesuit Catholic school, in a master's in public health program, how are we encouraging our students to be advocates, to be able to they come into public health because they're passionate about community health, right? That's what draws people into public health. And so they already come in wanting to be advocates. They may not know how to be advocates. And so that's something that we really teach them, how to hone your voice, how to know what your messaging is, how to know what it is that you want to say, and then how to be confident enough and assertive enough that you can say it. So using your voice, I think, is something that that our students they get out of the program. They may not express it or articulate it that way, right? But we try and teach them that is actually something that as they're thinking about what they've learned and how do they talk about themselves professionally, they have become these incredible advocates who now have really strong skills for using their voice, for being able to affect change in public health and community health settings. So working with Gwen, working with you has been terrific, and I think you're a really good example of when students are able to work on faculty projects, or when students have an idea and they want faculty mentorship around developing that idea. And so I think you're a really good example of how that's worked out for individual students. And do you want to share for just a second? I think you sharing a little bit about y'all's Break the Cycle work is really it's a really nice example of what you can do when you're doing your master's in public health.
Our proposal was specifically looking at echo anxiety with adolescents, so anxiety related to climate change, and kind of what is the issue, what support can we do for that, whether activism helps or makes that worse, those kind of things. So really trying to examine kind of different areas around that, which there's a real awakening of kind of the mental health effects of the environmental crisis at this point, particularly climate change. And so we ended up actually also, all 5 of us, doing our ILEX paper, so our master's thesis presentation, those kind of things on that. But also through that, we were accepted to present at the American Public Health Association, which has resulted in additional connections. I know the ongoing research in that, and Dr. Langle is still helping and supporting us even post-graduation. So it's been something that has been personally relevant. It's incredibly built our skills and abilities. It's grown our connection to the university and the program, and it has been a really amazing growth experience.